welfare program.
Okay, now, do you want me to look at
Whatever feels
or
comfortable.
do you
It's all
or
okay.
look at the camera?
Camera a little better.
Okay. So do you need to have him near the camera?
No.
Okay. All right.
Yeah,
I can do that though.
All right. I just feel like I'm ignoring you. That's all.
All right. Do you think that federal welfare programs are administered effectively in your district?
I think that there's always room for improvement. There have been situations of fraud that have been wasteful for the taxpayer and ultimately deny people truly in need. When I talk about fraud, I would not single it out to consumer fraud. Provider fraud has also been the more costly to the system. But through the years, when I was still in the state legislature and certainly witnessing in Washington, there are many, many efforts being addressed in healthcare reform, which was recently enacted, to address fraud with more opportunity, with greater resources, with a sharper focus, with stiffened penalties. And last year, I was able to present an award from the federal government to Attorney General Andrew Cuomo for having received the best marks across the country for work on fraud.
Okay. New York State's Medicare and Medicaid programs are often criticized for being so costly compared to other states. Do you feel that other states' Medicare and Medicaid programs are more effective than our own, or do you believe that that means there's reform for our state necessary?
Well, I think that, again, with healthcare, we'll be able to provide a better focus, a continuum of care. There'll be clinics in underserved areas, which will be very, very helpful. I think what is important to note that in the state of New York, where there are some additional measures provided, there can be foolish cuts made, where if you reduce, as some had wanted to, insulin and the needles required for diabetics, you're only going to have more complicated and complex situations arise when you deny people their basic health care needs to prevent or address wellness, to prevent illness or prevent it once it's diagnosed. I think that there are different ways that states package their Medicaid and programs, and I know that they've incorporated a lot of mental health aspects for New York State, which also is a benefit, I think, to the populace in terms of maintaining wellness. But I think what you'll see is a huge impact on all of these expenditures with the health care reform measure, which will bring in about 32 million additional people that are uninsured or underinsured today. And that will be a very helpful situation for a state like New York.
Okay. I know that you've mentioned that the healthcare reform will significantly impact Medicaid, but Medicaid's cost for New York State is estimated at about a third of the state budget. Do you think that healthcare reform will be enough to significantly decrease this cost?
I think you're going to see a huge decrease in a state like New York. When we, for instance, distributed FMAP monies, which were federal Medicaid assistance program dollars with the Recovery Act that was addressed to stop the bleeding of the recession, New York received the most in funding as we move forward. I think there's also a direct correlation with the economy. So as the economy improves and as insurance coverage improves, I think a state like New York will benefit greatly from a Medicaid perspective. And I think needed to be pointed out in any discussion is that the predominance of expenditures in an area like this, in the upstate New York region, is the long-term care for either through adult homes and nursing homes for the elderly. And I had represented, when I was in the state assembly, the highest concentration of senior citizens per capita of any district. And many of those individuals were not sitting on a golden nest egg of retirement. And so there will be these programs that enable people to stay well or maintain an order of response to their illness. And there's no denying, as a nation, we spend $2.4 trillion, and we need to find ways to more effectively invest in prevention and screening. We do it with health care by undoing the co-payments, the deductibles that will be required. So I think you'll see people put into a better construct, a continuum of care, rather than a haphazard way that we address it now, where people are not being responded to in most favorable measure or most efficient and effective use of resources.
Okay. On a county level, Montgomery County's biggest expense is also in health, social welfare programs. Do you think the same type of reform is necessary for the county, or is there a different form of reform?
Right. When I was in county government, or after I had left county government, with my experience there, and in my beginning stages in the state assembly, we brought in a team to assess just where some of the pressures were. The senior citizen population, of which I spoke, are a high bit of the dollar volume, and understandably so, and rightfully so. But with some of the youngsters, eye, ear, and nose and throat situations were off the charts. And there were those that we brought in to analyze that, and they suggested perhaps a programming effort be made that was more focused so as to reach these children and toddlers earlier. But to my awareness, that was really never followed through with. So there will be, I think, efforts in this healthcare reform package to offer these new constructs and to bring clinics into underserved areas and to create those continuum of care outcomes that will enable us, I think, to reduce the costs that are exorbitant for some individuals. What needs to be pointed out, too, is that a relative few, percentage-wise, of Medicaid eligible and Medicaid consuming are driving the spike in the overall costs of the programs. Their own personal health situations are very complex. They may be interwoven with mental health situations and with chronic illness that really makes their caseload very, very expensive, and that's what's driving the numbers, I believe.
Okay, thank you.
You're welcome.